Lorazepam is a benzodiazepine prescription medication that's most commonly known for treating anxiety. It can, however, also be used to treat insomnia associated with anxiety and stress. It can be used to treat some aspects of epilepsy, and it can also be used as a pre-medication for anesthetic procedures. In some situations, it may also be prescribed to help with alcohol withdrawal, but there are other benzodiazepines that are typically prescribed in this setting. When an individual is prescribed lorazepam for the first time, they're typically prescribed 2 to 3 milligrams per day, taken in divided doses throughout the day. After some time on the medication, it's common to see maintenance doses between 2 and 6 milligrams per day, again divided up throughout the day, and this can range from anywhere from 1 milligram all the way up to 10 milligrams daily. As another example, when a patient is prescribed lorazepam to treat insomnia, again associated with anxiety or stress, they'll typically use 2 to 4 milligrams at bedtime. After a person takes a dose of lorazepam, it typically starts to work within 20 to 30 minutes, and it reaches its peak sedating effect in 60 to 90 minutes. The effect of a dose could potentially last up to 6 to 8 hours. The most common side effect with this medication would be that sedating effect that we discussed that most people expect to experience with this medication. This can happen up to 16% of the time. Dizziness can happen up to 7% of the time, and about 3.5% of patients experience unsteadiness. Unfortunately, some patients who use lorazepam may experience symptoms of depression, and some patients can also experience delirium. One last thing to note about lorazepam or Ativan is that this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. So if you are in the elderly population, it's important to have a serious discussion with your physician before starting this medication. That's all we're going to talk about today in this short video about lorazepam. Take care.